Is the leader of the NDP, Claudia Chender. Claudia Chender, thanks so much. We appreciate your time.
Good morning, Todd.
Good morning. So initially, when I reached out to you, I wanted to talk to you about an unrelated story, and perhaps we'll get to that. But first, I want to get your take on this tragic death in the emergency room of this 37-year-old. Has the entire province reeling, and it's national news. What just kind of thoughts in general about this? First off, please.
Well, my first thought is exactly what you said. It's a tragedy. There's no two ways around it, and so, I think it's impossible to talk about this without first just expressing condolences to the family, to Allison's husband, and to the whole community, because it's clear she was really a pillar of her community. And so, obviously, I think that the real tragedy here is that our healthcare system is in crisis. We've known that for a long time, and this is just the latest evidence of that. And so I think it's a sad thing, and hopefully we can learn from it so that it's not repeated. We're a year and a half in to the mandate of a government who was elected on one issue, and that was to fix healthcare. And it's really gotten worse by every metric. And so I think what the family and what Nova Scotians want to hear from our premier is that he's going to take this and make sure it never happens again. And that might mean doing things differently, because despite being told over and over again that things are getting better, if you ask anyone on the street, they will tell you things are getting worse. And I think that's what we saw with this awful tragedy. And so I think, we all have resolved to make sure that this doesn't happen again.
All right. So you say by every metric things are getting worse. Can you give me some examples of that?
Oh, sure. Well, the newest wait list numbers for a family doctor were just released. We know that when people have an attachment to primary care, they're less likely to end up in the emergency room. So I think, we're now well north of, I can't remember the exact number, but north of 120,000, maybe even higher, 130,000 Nova Scotians without a family physician. Surgical wait times, we were supposed to have the wait list eliminated by now. They continue to climb. And those wait list numbers for surgeries don't actually include the people who are just waiting to get a consult to get on a wait list. And, everywhere around this province, the waits in the ER are atrocious. We know more and more Nova Scotians are leaving emergency rooms without even being seen. And this leads to even more kind of disastrous situations. And I think, a piece of that story around what happened in Tidnish was that they didn't even call an ambulance, because this family had such poor experiences with wait times around our ambulance system that they didn't even call. So everything is frayed. We have incredible healthcare workers at the center of our system who are, giving Herculean efforts in the face of totally challenging circumstances. And, I know that this government is trying, but whatever they're doing isn't working. And they fired the healthcare leadership when they came in. They made these big, bold moves, but we haven't seen the big, bold changes that were supposed to go along with that. And, there's some simple things that people are calling for, some of which, I think Elizabeth Smith McCrossin has outlined in some of her public statements, many of which we have pushed for in the legislature. And those have to do with making sure that the healthcare professionals we have stay. Yeah. So we hear a lot about recruitment, but we don't hear a lot about retention. We had the announcement, this massive healthcare infrastructure re-announcement, essentially, because we've been waiting now for years for this to happen, but it didn't include plans about staffing, when we know that one of the huge challenges we have is that we just don't have enough healthcare workers. So our system is under incredible strain. We look to the government to make it better in any situation, but particularly in the case where we have a government that was elected to fix healthcare, and Nova Scotians are ready for them to make good on that promise.
Right. So the health minister's response was that they would have a review. So that's kind of a, I guess, standard operating procedure. What's your response to that?
Well, I mean, I think that's the bare minimum, I think, for the family. and for the system. We need to understand how it happened. But I think that increasingly I'm hearing from folks who are saying, we want to understand why this happened. We want to know that if we go to an emergency room, we'll get the care that we need. And Nova Scotians need to be assured of that, because the reality is we don't have an alternative. We don't have an alternative if we're in medical distress to going to the emergency room or calling 911 or, waiting for an ambulance. So I think the government has to have some more transparency. I think we have to understand what they have learned from this terrible tragedy and how they're going to make things better. So certainly we will be pushing for more information to the public, because we need people to have confidence in our healthcare system and be able to use it. So that's something we will be watching. And I heard your intro, Todd, where you talked about this sort of issue with privacy concerns that the Department of Justice cited. And I don't have any firsthand knowledge of that information, but I would just say, that I would caution that the government is careful here, because privacy really attaches to the person. And of course, Alison Holthoff has passed away, and her husband has chosen to make this public in a very generous way, presumably to ensure that nobody has to experience it again. And so it's his privacy, and it's his decision about what to do with that privacy. And if we can learn from this incident, then I think hopefully that will be some small solace.
All right, you mentioned the healthcare workers and the Herculean effort that they've made, and nobody would deny that. But that all said, part of this review, I think, should include, is this simply just a human resources issue, just a lack of human resources, or might there have been something somebody missed? Might there be some, I don't know if accountability is the right word, but maybe somebody missed something here, right? I don't think we can completely dismiss that scenario here. Sure. What are your thoughts on that?
Well, I think that's entirely possible, and I think that's why it's a good thing that anytime anything like this happens, there is that review, because that we want to understand that. We want to make sure that nothing got missed, of course. But we also know that the situation in our emergency rooms across the province are incredibly, incredibly stressful, and that, people are working short-shifted, short-staffed, much more often than not. Many nurses are working overtime. And so I think we can't look at what happened in this case without looking at the context. And the context is that, our emergency care situation in this province is in crisis, and that's really a downstream symptom of the fact that many Nova Scotians don't have primary care. So we have to attack it on all fronts. We have to make sure that we are addressing the basic needs of Nova Scotians who may be lying on their floor with a broken hip, or have abdominal pain, or have a parent or a child who is in some kind of distress and needs to go to the hospital. We need to understand that they can get good care there. And so, based on all of the things that we've seen in the last few years, there's very little to suggest that the root of the major challenges is some kind of negligence or lack of knowledge. Systemically, we have a challenge where we don't have enough staff. Our systems may not be up to snuff, and we need to fix that. That's what Tim Houston said he was going to do, and I think now more than ever, Nova Scotians need to hold him to that.
All right, just quickly before I let you go, I do want to touch on this story from last week. You say that although you were happy to see newcomers bound for the province when it comes to CCAs after this recruitment tour to this refugee camp in Kenya, you feel that the government may be too focused on immigration amid a housing and public service crisis. I did have a chat with Suzanne Lay, who was on the recruitment trip, and I asked her about that, and she said that they are working with the sector, with the employers, and she suggested that this is being addressed, this housing concern. What do we now know about this? What can you tell us?
Well, I'll just correct you a little and say I'm not concerned that there's too much focus on immigration. I think immigration has been an incredible boost.
All right, I'll clarify that. That's what the CBC story said. I should have said that actually.
Okay, I never said that. What I did say is that if we are going to focus on immigration in the way that this government has chosen to, then we must have a similar and equal focus on ensuring that there are housing and services for the people who we are attracting to our province, particularly if we are going to bring people from refugee camps, people who are vulnerable and have already been traumatized. We must ensure that when they arrive here, they will not be re-traumatized. And so if you talk to many people across this province, they will say that aside from healthcare, one of the biggest challenges they have is housing. And so I'm glad to hear sort of vague assurances that there's work happening on ensuring that there's housing. We don't have any information on that. We don't have an announcement about that. And so, my response after, this was after Cabinet on Thursday, when they say, what do you think of this? Well, if you look at what's happening in Cape Breton and Sydney, we know that while international students have transformed Sydney, quite frankly, and been an incredible asset, I would say, to that community, and most people would say, and to CBU and its sustainability as an institution, I think there are big questions about whether we are keeping up our end of the bargain. Many of these students are living in crowded, cramped accommodations, going to school in a movie theater, not getting what they were promised. And similarly, if we're going to, bring folks into the province, we need to make sure that we are delivering, that if we're attracting them here for a promise of a better life, that includes a safe place to live. And so we're looking for details. We want to know that our housing and services have been thought of before those contracts are signed, so that we know that those people will have essentially what they're expecting.
Claudia, I appreciate your time. Thank you so much.
Thank you.
Claudia Chender, leader